Crisis pregnancy centers do whatever it takes to get people in the door. That includes changing their names, their logos, where they get set up. It's all about manipulation to dissuade people from having an abortion. And today we're going to talk about it. I'm Teal. I'm the research coordinator from the BC Humanist Association. And today I'm joined by Leslie.
And I am a registered nurse who's worked in women's health for the better part of the last 40 years.
And today we're going to be taking a deep dive into one website of a crisis pregnancy center. But before we do, what are crisis pregnancy centers, Leslie?
Crisis pregnancy centers have set themselves up as apparently legitimate information, possibly clinical places where people who are experiencing an unplanned pregnancy are invited in unknowingly to a place where they are not going to get accurate information about all of their pregnancy options.
These are effectively fake clinics. These aren't offering people all the options in an open environment, up-to-date, accurate information. They're engaged in motivated counseling. Their goal is to dissuade people from having an abortion, someone who's experiencing an unplanned pregnancy. What are some of the harms of that?
People show up and they may or may not have made the decision to terminate a pregnancy. They may be exploring what their legitimate options are. They're not given accurate medical information regarding pregnancy termination. They're not given access to legitimate counseling. These people are peer counselors at best. They're not given referrals. They're not sent to a midwife or a nurse practitioner or a physician, where we want all newly pregnant women, regardless of what their plans for the pregnancy are, to attend as early as possible so that they can get the information they need to make an informed choice for their lives.
Right. And delays make a difference, right? Imagine someone goes to a clinic and that could delay them seeking real advice from a real clinic by a day or a couple of weeks, depending on when they get to see their doctor. And that can have implications as to what kind of options are available to a person and have a lifelong effect. So these crisis pregnancy centers have a huge harm. And one of the projects the Abortion Rights Coalition of Canada and the BC Humanist Association has been doing for the last little while has been analyzing the websites of crisis pregnancy centers to understand some of the manipulation tactics that they use. Today, we're going to be exploring one of those crisis pregnancy center websites. We're going all the way to Winnipeg to Family Support Center. Tell me a bit more about this organization.
The Family Support Center for many, many years was the Crisis Pregnancy Center. And they have very recently rebranded themselves as the Family Support Center. Interestingly, there is a very legitimate family support center about a block away called the Acorn Family Support Center, who hire professionals and do really exceptionally good work with families. So I don't think that's an accident. I think that people may be looking for Acorn and ending up here.
I think you're totally right. And this is actually a tactic. When we looked at crisis pregnancy centers, they're constantly changing their names. And you can see what Leslie's talking about. Like, you type in the Family Support Center, you're getting a crisis pregnancy center, and they're very close to each other. Here's the Acorn Family Place. And here's the Crisis Pregnancy Center of Winnipeg. Sometimes crisis pregnancy centers will quite literally set up across the street from a real clinic, and their hope is that people just go in the wrong door and get their motivated counseling rather than real effective counseling with all available information. We've also seen some crisis pregnancy centers that will have very similar logos to real clinics, similar acronyms, and these are other sort of deceptive ways of just trying to get people in the door. So the Family Support Center, let's see what we see on their website. Immediately we see a bit of kind of general counseling content here. We're going to go down to the FAQs because when Leslie and I were looking over this, we found some very interesting things. When we talk about crisis pregnancy centers, we have to realize that these are set up to dissuade people from having an abortion, but they're also set up often as religious ministries. Some organizations will attempt to hide their religiosity, and you often have to look in the footnotes and figure out who their funders and donors are by clicking through many buttons. This organization doesn't seem to be doing that, which is somewhat reassuring. You've got a cross in the logo, some leaves, so that's kind of overt. And when we go to their FAQ, this one was interesting, Leslie. It's what is the difference between Christian and secular counseling? Let's find out. Let me know what you think.
Well, I know what I think, but it's not what they think. So
this is pretty funny. So we've got the great question. Pretty much nothing, unless you want it to be different. Like, I mean, it's already got that kind of camp and paternalistic vibe that you expect from these kinds of websites. This is a challenge, right? So here's an organization that's saying we do Christian counseling. There's a problem with that. What's the problem with like someone just putting up a shingle and calling themselves a counselor, Leslie?
Well, it's a huge problem, and that can happen. Unfortunately, it seems that counselor is not a protected title. So, you and I could hang up the Teal and Leslie Counseling Center, although I don't know that that would be a very good idea for people. Um, I think that somebody can be Christian and be a counselor. I think that the two are certainly not mutually exclusive, but these are peer counselors. And that's a very different kettle of fish. What they bring to the table in this case is their faith and not necessarily any particular skill or information in unplanned pregnancy counseling.
You're spot on, right? Like anyone can call themselves a counselor, but we don't have any certification or insurances that this person is going to be providing all the information. We're interested in specifically counseling around unplanned pregnancy. So let's see what it says. How do I get pregnancy counseling in Winnipeg? This one's quite fun. Come see us. So, I guess it makes sense, kind of promote yourself, but it is a bit strange that they wouldn't also provide links to other options. And then we go a little further along, and we find the classic question of where can I find an abortion clinic? So here's someone who wants to have an abortion. They're looking for a clinic. And these folks in their FAQ say, like, go to some hospitals. There's some clinics around. Shrug emoji. Like, we're not actually getting anything substantive. If this was a website with actual resources, it would provide links to all the options in town. But we don't have one. Instead, more lines like, this is a big decision. Make sure you're doing your research. Do lots of online research and go from there. They do have a click to their disclaimer. We're going to click on that in a second, but there's one other one that I thought was very interesting, and that was just down here, which is, I'm pregnant and I do not want to be. What can I do? When you read that question, what does that tell you? What is that question asking, Leslie?
It tells me that this person wants to know what their options are around not being pregnant. So they would probably like to terminate their pregnancy. Certainly want the information that they need in order to make that decision.
You would hope
Yep.
that a legitimate website would have resources on where you could find safe abortion. And yet here we totally get it. Come talk to us. They're trying to get people in the door, or they're reinforcing fear tactics. It's a scary and difficult time. It's hard not to panic. Take deep breaths. Bit paternalistic as well. I always find these websites a little bit heavy-handed in that. Come meet us. One thing that we've noticed when we analyzed crisis pregnancy center websites over time is that a lot of them have been reducing the amount of information they actually have on their website. They used to have information about health issues and various details about types of abortions and things like that, and made up diseases like post-abortion syndrome and abortion pill reversal, things like that. But a lot of the websites have been removing them and just trying to get people in the door to talk to them. And that is always a worry, because that means that people who are seeking out accurate information have to go in the door to talk to them, where they can be more easily manipulated in that in-person situation. So we've got what they can do to help. And again, if someone is pregnant and looking for the options that are available to them, one would hope that there would be resources. We get a link to services, again, trying to get you in the door. And let's look at this disclaimer, because this a big red disclaimer is always something worth clicking on. Quite often, these crisis pregnancy centers will bury them in small print. What do we see here, Leslie? Walk me through it.
They'd like to talk to us. They're welcoming that opportunity. They are free of charge, which is a hook, because often mental health therapy isn't free of charge. We know that. And makes it very inaccessible to people. They're not a professional counseling agency.
Right here.
Which is problematic in my opinion. So they're a peer support. People don't necessarily understand their limitations. They may or may not even look at the disclaimer. They also go on to say that they're not a medical facility, and they do not provide for nor arrange medical treatments. And they don't provide assistance in arranging abortions. They don't even say, hey, like, this isn't what we do, but a very good place like Women's Health Clinic, which is 1.3 kilometers up the road, that does provide all of these services, is available to you, or you can call this number. Like, there's any number of things they could be doing that they're not.
And I think that's a really key thing. This whole idea of like peer counseling, it sounds nifty, but that means that this person's not certified and may not be, for example, prepared or trained in trauma-informed counseling. They may not have the resources available. And what we also know is this is intentionally, and they at least they say this in their disclaimer. I will give them a pat on the back. for what it's worth for at least like being overt about this, because we've seen a lot of groups that will try to hide their religious motivations. So someone who's going in there is getting a group that is not trying to give them all the options. And again, remember, these are people in a vulnerable situation. People are very prone to manipulation, especially from someone who's pretending to be a doctor or counselor. And folks may not even see the disclaimer. Let's go back to the main site here and see what happens if you're looking at pregnancy and post-abortion information and help. People will notice that there's also a little chat box at the bottom there. You can do a live chat. Sometimes it's with a person, sometimes it's with a chat bot. So we click on pregnancy and post-pregnancy care, and it's taking us actually to another website. This is an online care online crisis pregnancy center. And so we're already off their website, but again, they're trying to get us to chat. You can see all these buttons trying to get people to have a conversation. Every single one, start a conversation, have a conversation with us, start a conversation. Every single button is trying to get someone talking in a counseling situation rather than having information on the website. What stands out to you here, Leslie? What do you want to, what should we click on next?
Well, let's click on I've had an abortion.
Perfect. Let's see what happens to that.
Let's
So yeah,
start
so
it.
here we are. I've had an abortion already. And I will say this much, having looked at hundreds of these websites. By the way, there's about 143 crisis pregnancy centers in Canada, and some of them have shared websites. This is one of those shared websites. Having looked at hundreds of these, we can already see the kind of stock photos you tend to expect. Bleak, woman staring wistfully out at the rain. So you already have it reinforcing these negative emotions. This is problematic. Talk to me about this, Leslie.
According to PubMed this week, the rates of women who are suffering from any mental health issues post-abortion that they did not have pre-abortion is not statistically significant.
And I've seen this as well, where like the number one feeling that people have after an abortion tends to be relief. And like we're talking statistically significant numbers, the vast majority of people feel relief. And that's held up by quite a lot of empirical research.
Exactly. People have to make hard decisions in their life. And I don't think that women have abortions and take the decision lightly, regardless of whether they come to the realization immediately upon testing pregnant or they think about it for a while. And for many women, it is a difficult decision. For some women, it is not a difficult decision. I think that what these places are also trying to do is they're trying to tell people they should feel a certain way. They're trying to explain to them that this is huge, it's life altering. And for many women, it isn't. And for many women, it is. And I think that afterwards, most women feel a sense of relief. It doesn't mean that they don't feel some sadness. It doesn't mean that they don't feel they wish that things had been different, but it's the right decision for them. And they recognize that and they get on with their lives immediately.
The way that they frame the issue reinforces these negative traits. Like here we're saying, one of the aspects of distress you may be experiencing is grief. Post-abortion grief is interesting. Some places will talk about post-abortion syndrome, which is a made-up term by the crisis pregnancy center industry. Fortunately, they're not using that term here, but we see this reinforcing negative stigma and taboo around abortions by like listing the symptoms. And again, remember, like this is just not the case. Like there isn't strong empirical evidence supporting these claims. So yeah, effectively what we see is this reinforcing of negativity around abortions through the way that they present the issue. And that's a problem. Now, this website here, Care Online, is kind of an online chatbot crisis pregnancy center site that a lot of crisis pregnancy centers will share. So we should probably bring ourselves back home to where we started, which was our family support center. What I think is really interesting here is we don't have a lot of information about the options. We aren't seeing detailed information about how do you get an abortion, what are the options, how does adoption work, what are your options for prenatal treatments and things like that. It's all trying to drive you to their chat programs. Let's compare and contrast this to a actual clinic that provides open and accurate and up-to-date and judgment-free information. There's the Women's Health Clinic in Winnipeg is one you were going to recommend, right, Leslie, I believe. Is that right?
That would be the one, yeah, because it's also very close physically to this clinic.
Yeah, so let's take a look at this website. We've got focus on inclusion, feminist community health clinic. There's a lot of resources here, folks. So let's take a look specifically at their pregnancy resources. But here we've got information, abortions up there. They talk about the different abortion options they offer, birth control, counseling services. What jumps out at you here, Leslie?
Well, I feel like there was a box somewhere in there that talked about abortion services.
Yeah,
so
I think I found one here. Let's check it out.
There we go. Okay.
Yeah. It's in the services offered. Here we go. Brilliant. Okay, so we've got information on abortion, You've got right up front, abortion is legal in Canada. You do not need permission of a partner or parents to have an abortion. Very good information to have. Didn't see that on the other website now, did we? Let's
No,
scroll
we
down and
sure
take a bit
didn't.
of a dive in here. We've got some information about different options. There's detailed information about how they do their abortions, the different services they offer, when you can get access to them.
Click on counseling, because I don't know
Are
if
you
that's
thinking
just,
birth control and pregnancy counseling? Should we try that one instead?
yeah, that's the one. So they have, so they also have volunteer counselors, interestingly, as their initial point of access. And I've actually done that training. What they are there to provide is not even decision-making information, but information about abortion, adoption, and parenting. They have a stock legitimate information piece with resources that they would go over with the woman who is deciding what option she wishes to pursue with her unplanned pregnancy.
Yes, that you can make an appointment. You can call to find a time to meet with them, but they also have resources on their website. Let's check those out. We're going to another website off-site, but it's a whole workbook. So it's basically, we haven't had a chance to look through these in a lot of detail, but it looks like we've got different options. So we can click on that. And you got your three options: adoption, parenting, or abortion. You've got information about how to go through the workbook, and that's taking you to like detailed resources that help people make a decision. The goal in this kind of counseling, friends, shouldn't be to push someone in the direction of a specific decision. That's not what a good counselor does. What they do is they provide people with all the information available so that person can make an informed decision that works best for them in their life, in their circumstances, and then you support the person in that decision. And you'll notice that this website contrasts heavily with the other website we were looking at, where they're providing detailed information. They're providing people with websites and resources that are off their site, that are open, and provide the information in a way that is not biased. Whereas here, again, remember, we saw the question in our FAQ section where if someone's seeking a pregnancy, it's not, here's some resources you can take and use to best find an abortion near you. It's come talk to us anyways. So that's the kind of slippery manipulation we see from crisis pregnancy centers.
When you look at the Google reviews, they were kind of scathing. It was good. Okay, so this is 9 years ago. This is a front for the church, fully pro-life, offer no information of other options for your pregnancy.
Looks like it says here manipulation. That's always a big
Yeah, that's a
flag.
pretty big red flag. Pro-life choices, pro-life and anti-women.
Looks like we're getting a lot of actually there's some helpful information about where you can get real medical support in the Google reviews, which is very helpful. It looks like there's a bit of a battle going out here in the comment section. A lot of people
Yeah.
had negative reviews.
If what you are looking for is, I want to continue my pregnancy and I need help, these people might actually offer that demographic of the population something valuable to them. And that's fine. The problem is that that's not what their shingle says. Their shingle says that they are offering decision-making advice for unwanted or unplanned pregnancies. And that's not what they're doing.
The Abortion Rights Coalition of Canada and the BC Humanist Association and activists across the country are working to combat the harm that crisis pregnancy centers do. We have a report that we put out a couple of years ago that explored crisis pregnancy center websites. We'll put a link in the video description. And if you're interested in getting involved, we have an amazing research team that works on this issue. The goal here is to prevent people from being harmed by these fake clinics that are aimed at manipulation and at motivated counseling. Leslie, thank you so much for joining me on this website walkthrough, and I'm looking forward to doing some more with you in the future.
Thank you so much, Teal. It's been a pleasure.